I'm Frank Kim, the County Executive Officer for the County of Orange. I want to welcome you to our press conference. Today we'll be speaking about the amended health order and guidance document that will be released by the County of Orange. I'd like to introduce our speakers today. We have our Health Officer, Dr. Nicole Quick. We have Chairwoman Michelle Steele, 2nd District, and Supervisor Don Wagner from the 3rd District. Following their comments, we will have available Richard Sanchez, Director of the Healthcare Agency, as well as our first responders who will be available to answer any questions. And with that, I'll turn this over to Chairwoman Michelle Steele.
Good afternoon, everyone. I am Michelle Steele, Chairwoman of the Orange County Board of Supervisors. There has been confusion about the wording and meaning of yesterday's public health order. But let me make it very clear. Orange County is not on lockdown. And except for businesses directly to close by the state, all businesses can remain open. This Orange County amended order and guidance does not supersede state and federal guidelines. The County Board of Supervisors will do everything in our power to fight and defeat coronavirus, but we cannot do this alone. We are asking the private sector and the public to do their part and work together to protect Orange County public health and safety. And thank you, and I'm going to invite Supervisor Don Wagner.
Thanks, Supervisor Steele, and thank you all for coming out. You've heard the upshot of what we're trying to do here. It is a new order from Dr. Quick, who is the health professional upon whom we all on the board rely for these decisions. The most important point, though, to make, I think, is that Orange County is not shut down for business. We are asking all of our citizens to be responsible in how you are interacting out in the community. We're talking about social distancing. We're talking about just some of the ordinary things necessary to keep us from spreading germs. Obvious things like hand washing, being careful with the use and disposal of Kleenexes and tissue. But we are also very clear, we are not trying to shut down business in the County of Orange. If you have a business, even if it is not one of those defined by the state as essential, you're still able to operate today. We would like you to practice the responsible social distancing that we're talking about. We're asking you to avoid gatherings of large numbers of people. We're asking, to the extent telecommunication is possible, do it. But don't turn away your business. Don't say, I'm closed down, and worry that the sheriff's department is going to come and arrest you for going to work in the morning. We have Sheriff Don Barnes here to talk about that in more detail if you have questions. The bottom line is we are trying to be as responsible and responsive to this disease as possible, at the same time making sure you are able to go about providing for yourselves, for your families, for your friends, for your neighbors. I'd add, in this somewhat unprecedented, very difficult time, we will have folks who are socially isolating themselves, trying to protect themselves to the extent possible. If you know somebody that falls into that category, make sure you reach out to them. Maybe by phone. I'm not sure you want to go over to the house. Reach out. Make sure people that you know and that are isolating themselves have what they need in terms of food, in terms of water, in terms of an opportunity to be successful in that self-isolation. One of the things that was said at the board meeting the other day was that we are the help for each other until help arrives. Well, that's especially true in these circumstances. Let's help each other. We've asked at the board meeting the other day that some of our local police departments, for example, lighten up on their enforcement of things like parking infractions, that sort of stuff. Throughout the county, we'd like to see this is an opportunity for people to re-engage with their friends and neighbors at the same time while practicing responsible social distancing. So Orange County is not closed. You are not going to jail if you do business today. We're asking you be safe, be smart, follow the guidelines that Dr. Quick will outline and that the state of California has outlined. And to the extent anyone is confused, hopefully it's clarified in the order that comes out today. And if not, trust me, my office has been fielding and will continue to field calls trying to clarify. I know Chairman Steele and my colleagues' offices have been fielding calls and will continue to field calls to try to clarify. We're all in this together, and we're asking for your help to get yourselves, your friends, your neighbors, and collectively all of us through this. And I guess I will turn it over to Dr. Quick at this point, and then maybe we'll have some questions. Thank you all.
Good afternoon, everyone. My name is Dr. Nicole Quick, County Health Officer. Thank you all for coming today. Today I issued a health officer order which is in effect through 11:59 p.m. on March 31st. Because this is a rapidly evolving situation, it is important to note that the order may be revised at any point in time. In line with the California Department of Public Health, I have stopped all non-essential professional, social, and community gatherings. As of today, there are 42 cases of COVID-19 in Orange County. 22 of those cases are travel related, 7 of those are person-to-person spread, and 12 are community acquired, and 1 remains under investigation. Also important to note, as I've said before, the more that we look for this, the more we're likely to find, so increasing cases are not unexpected. We as a county realize that the mitigation strategies that have been rolled out this week by schools, businesses, and all levels of government are concerning for community members. We empathize and want to thank OC residents for their flexibility and willingness to make adjustments to their daily lives to help protect and promote the health and well-being of everyone. Thank you.
Thank you, Dr. Quick. And with that, I think we'll take questions from the media at this time.
I think it's a
Can you
question for
clarify
Dr.
for
Quick.
everyone out there, because we've gotten lots and lots of calls from people, business owners who took yesterday's order that if they were not on that essential list or that exempt list, that if they weren't that type of business, they had to shut down and they were confused. Can you clarify that? Are any businesses being asked to shut down besides bars?
So the order today identifies, and this is consistent with the guidance from the California Department of Public Health. So there's bars, and it is the in-room dining at restaurants. And so those are the two, as well as health clubs and movie theaters and gyms. So those were the set of businesses that were specifically identified by the state, and those are the actions that Dr. Quick has taken order on.
Was it the intent to initially have other businesses that weren't in that essential
No,
list shut
no.
down, and you guys
I
are walking
think-
it back now?
No, absolutely not.
Was it never the intent to have?
That was never the intent. I think there was a misunderstanding in terms of the first order. When we read the order, we thought it was clear, but following calls that we received from the media as well as from concerned businesses, it became evident to us that our document could be read more clearly. So we endeavored this morning, obviously, to rewrite it in a way that makes it crystal clear. And in fact, if you look at section 2 of the document that we released, it identifies very clearly that we encourage all businesses to remain open and simply follow the guidance from the California Department of Public Health for social distancing, etc.
On that issue of large
For
gatherings,
clarification on this, because we were afraid of this kind of confusion, we were denied any kind of interview or any kind of news conference. Should this news conference today have happened yesterday so there wasn't any of this confusion?
Well, I apologize for that because this document was released yesterday. We did work to provide a press release yesterday in the afternoon that identified that this was not certainly a shutdown. This was not the kind of shelter-in-place type of orders that we've seen in other counties and jurisdictions. It was never our intent to do that, and we're happy that we have an opportunity today to address the media and make it very clear to Orange County businesses and residents. We encourage you to stay open. We encourage you to be safe. We encourage you to follow the guidance from the California Department of Public Health.
Frank, can you address the very first line that seemed to throw so many people off about gatherings of any number? And today, tell folks from Orange County, can they go out? Can they walk their dog? Can they be on a public sidewalk?
I think absolutely. I think it is healthy for residents in Orange County to be outside, to enjoy the outdoor activities, etc. I think what we're asking is that in that function, follow the guidance that is in the state documents related to your own social distancing, as well as the guidance related to large gatherings. So what we're saying is, look, we have a virus, it's here in our community, and it's spread by person-to-person contact generally. So to the extent that you can, if you can limit the social distancing and maintain that per the guidance, we stand a much better chance in our community of reducing the spread of this virus from person to person. That really is what we're asking for.
Should more businesses fall under this emergency order? Today we went to a lot of nail salons, a lot of hair salons, and it's really hard to do your job being 6 feet apart from
I think that's a very good question. And obviously, our goal is to write a document and an order that provides clarity. But in doing that, I think the challenge that we have is if we try to identify every business that would be directly affected, then you get calls from other businesses that say, oh, I didn't see my industry in there. Am I okay? So the goal was for us to write it fairly broadly while delivering the message that we are business friendly, that we encourage our economy to continue to prosper and to deal with this temporary situation that we're in. And while at the same time, our goal is to create a frequently asked questions document that can be an accompaniment to the order, so that as we get those kinds of questions, we're able to group those questions together and then release a separate guidance that can be modified day to day as those kinds of individual one-off requests do come in. So our plan is to address that through that medium.
Do you have any rules, guidelines for churches for this coming weekend?
So in terms of the public gathering, the current order, I don't want to speak for the healthcare agency. Maybe I will ask our director to address that specifically. But I don't believe that our current order allows for the gathering of multiple people where you cannot maintain that 6 feet of social distancing.
Correct. So if they have church, they would have to have pews set up in a way where people are sitting down. They can have it, but they have to be 6 feet apart, is that?
Exactly. And from what we've seen within our community churches and religious organizations, many have gone to alternate forms of participating and sharing that worship with their parishioners. And they've done that online, and they've done other alternatives.
And so one more time, kind of very clearly, so people out there don't have any confusion about this, state what business types are not allowed open, no bars, any other business types that...
Those are listed in our guidance document and
Well, that's
in the
what confused
order.
everybody, though.
So
I'm assuming that our new guidance has been posted, and if it hasn't, it should be fairly quickly. There is very specific guidance on very specific areas. All bars and other business establishments that serve alcohol and do not serve shall close. That's crystal clear. If anybody has any questions on that one, I'm happy to answer.
Do you mean doesn't serve food?
That's exactly what it said.
Okay, but
Does
I
not
think
serve
you said
food.
food.
All movie theaters, gyms, and health clubs shall close. Any questions on that one? Food and beverage establishments, food trucks, grocery stores, and charitable food distribution sites and certified farmers markets are required to follow guidance released from the California Department of Public Health on March 16th, 2020. All food shall be by delivery or through pickup or drive-through. For purposes of food delivery and pickup, social distancing defined as maintaining a 6-foot separation per person for non-family members shall be required. That's the extent of it.
So bars, movie theaters, and gyms, that's it.
Exactly what I just said.
I know, I'm clarifying, sir.
Sure.
So just those three. Okay.
So Richard, this really is mimicking what the state has
This is
said?
verbatim from the California Department of Public Health, state agency.
Hence the confusion yesterday when we saw that.
Yes.
Do you think there's a sort of conflation here, naturally, where people assuming, well, they're sheltering in place and doing more quarantining up north, so maybe it's applying here. Is there some point, obviously that's not the message you want to give out,
Yes, there is.
but is there some point where it will, that
So
may have to happen here?
what you're referring to is what's happened specifically, let's say, San Francisco County. They've decided to, it's the term that's being used in the media is shelter in place. It's actually quarantine in place. As you may know, with the COVID patients that are symptomatic but don't have any reason to believe that they came in contact or traveled to one of the countries, we do ask them to quarantine in place. 14 days. Stay at home, minimize movement, hopefully have a room to yourself with its own bathroom. San Francisco has gone that far. Orange County has not. We have not done that.
So for maybe families that are home right now that might want to combine learning with other kids, other families, if they maintain a 6-foot social distance between students in a house, maybe family, cousins together, is that considered okay?
So just know that there are some that are called out specifically exempt from this. One of them is childcare. So childcare is exempt from this. And what you're describing, family members, is also called out as family members, of course, that are cohabitating can absolutely get together.
Anything else exempt
There's a list.
specifically?
Okay.
It's a crystal ball question, but are there numbers, maybe Dr. Quick, where we'll get to a point where these businesses might be ordered to close?
I don't know that there's a
Percentage
magic
of?
number for that. It'll be interesting to see how that plays out. What we've done, just our pattern in Orange County has been, all of the actions that we've taken, all of the guidance we provided, this order that we're providing even today, mimics what the state of California, California Department of Public Health has given us guidance on. We really haven't taken any kind of action separate from that. As I said at the Board of Supervisors the other day, it is important during this whole situation that we have consistency in messaging because I think that's where we get confusion.
Any information on how this will affect courthouses? Or does this apply to courthouses at all?
The courts are not specifically named, but I believe that the courts did take some action. I'm looking for the list of exceptions. I'll find it in a minute.
I know there were, 29 cases yesterday here in Orange County, now 42, am I correct on that?
There are 29? Oh, I'm sorry. The number, just know, if I say something that may change later, it may change later. Right now, today, 42.
And yesterday was 29.
Correct. I do have the exceptions if you'd like to hear them. With respect to the prohibitions on gathering, this order does not apply to essential public transportation, airport travel, shopping at a store mall, farmer's market, charitable food pantries, distributions, or to congregate living situations, including dormitories and homeless encampments. And then we link to the actual guidance from the state on that.
So like an acupuncturist, they can still see patients because they have to put needles into a person? I mean, is that something that's...
Here's the deal on this whole thing. Can I just say, are we going to be patrolling the streets looking for this? We're not. We are not. We know through other sources if we have travelers coming to Orange County. We know through our healthcare system when we have somebody that's a suspect case. If we find out a situation that we do have to intervene in, we will intervene. Otherwise, and I don't want to speak for Sheriff Barnes, but we're not expecting him to go out patrolling the streets for bars that are open or groups that are gathering. We hope that the public is listening to what Supervisor Wagner said. We're all in this together. We're here to protect public health, and we want cooperation. Please.
On that subject, let me just add that the response we've been seeing, at least in my office, has actually been somewhat gratifying. We're having people say, things like, I don't understand the order, does it apply to me, I don't want to be in violation of the order, what can I do to help myself and my employees, for example. And so what we're seeing by and large is an awful lot of public buy-in and folks wanting to do the right thing, which I'm, number one, thrilled to see, and number two, in no way surprised to see here in Orange County. What I think Richard is saying is that we are expecting compliance because we are seeing our citizens already trying to do the right thing. And so, again, not speaking for Sheriff Barnes, I know he has a handle on this. We had a meeting before coming out here where he made it abundantly clear that he has got this situation under control. But by and large, we're seeing compliance and we're seeing everyone pitching in. We're trying not to write an order that is mandatory and ham-handed. Protect yourselves, protect your loved ones, protect your neighbors. People are responding to that message, I believe.
You see people, you tell people to take hikes or take walks, stuff like that, but at the parks, like yesterday at the Tustin Sports Park, there was a large group of people playing tennis over there. Do you still allow that type of thing, or do you plan on closing public parks?
Well, Dr. Quick, are we going to close public parks? I mean, that ultimately is not a call for the policymakers, that's a call for the doctor.
I think the state parks have closed, right?
Well, this is a city park.
No, I know, but I mean, I think the state parks have closed.
It's not Orange County Parks, as of yet.
But you say you try to mimic what the state has been advising, correct?
That wasn't, we follow California Department of Public Health.
And I don't know, maybe this is a question for you, Sheriff. I know I saw some agency policing the bar district, I think it was San Diego maybe, and they were just kind of gently reminding these bars that were still occupied with people, hey, this is the order and this is what we'd like you to comply with. Is that something maybe if your deputies see a bar open and it's got tons of people, will they stop and just say gently remind that business?
If it's one of the establishments that have been directed to cease operations, there's no better time to test that procedure than on St. Patrick's Day. So we were out last night, we were asking for voluntary compliance, we received it, we didn't have any issues with any of the businesses that were operating probably, not, I don't think, despite the order, but maybe without informed of the order, and they were completely cooperative with us. We are asking for the public's voluntary compliance. That's what we're asking for. At some point in response to this, with the directives coming out from Dr. Quick and through the state that we are emulating, we have to have a stopgap, and the stopgap needs to happen today, not a week from today, not a month from today. We need everybody to buy in unilaterally across the county on the recommendations that are being made and recommended. If you're sick, stay home. Self-quarantine if you have been exposed. Wash your hands, all the hygiene issues that we're asking for. We have taken very proactive steps weeks ago within the Sheriff's Department to get out ahead of this. This situation is absolutely unique in one very clear way. If I were working with Chief Brian Fennessy on the law side of a fire or an emergency, oftentimes those are incident-driven and unique to one location. The wildland fires stressed California last year. We had multiple incidents happening up and down the state that took Chief Fennessy's resources and law enforcement support throughout the state, and we ebb and flow with those service demands. Everybody's dealing with this incident. Everybody's making requests for resources. Everybody's tasking the system at the same time, and it's very challenging. We have gotten out ahead of this with our staff. We had a meeting yesterday with all the chiefs of police in Orange County to talk about deployment models, preventative measures, how to respond, how to quarantine, so that if one of our deputies, officers, or one of Chief Fennessy's personnel gets exposed, that we can appropriately respond, isolate that individual, and maintain continuity of operations, which is why we've gone to platoon schedules. So we're not cross-contaminating shift to shift. We did this, we've got that in place now. We have a cadre of resources that we've taken and put in reserve, so if a shift has an exposure, we can take that shift out and respond appropriately by putting a whole fresh shift in that is new and uncontaminated, if you will. We've gotten way out ahead of this with our staff. We are making resource requests through the state, but it's at the same time that everybody's making resource requests. So we've got a good plan. The plan is only as good as the public's response to our plan, which is do the things we're asking you to do, social distancing, hygiene, covering your mouth when you sneeze, follow the orders that are in place about congregating together in large groups, and make sure that we all universally respond the same way.
Did you have any bars that you found last night that were open?
Yeah, there were bars that were operating, but they were compliant, and we were able to resolve those issues.
Can you talk about how those interactions went with the deputies in the bar?
It was informative, and the locations that we were dealing with complied, and it was without issue. I think even the patrons there, as much as they wanted to celebrate St. Patrick's Day, realized that this is much bigger than one day a year. And when you express the risk, we all know what the risks are about social contact and bridging that 6-foot gap. That's the important part. So these are the things we're asking for, not only of our staff. We've implemented protocols. We're asking pre-screening questions before we respond to calls for service. Where necessary, we're handling calls for service over the phone rather than having contact with individuals to minimize the number of contacts we have with the public we serve. And in all, it's been well received because they understand the precaution that we're taking and the necessity for it.
What about active policing? Of course, you have to make calls with violent crime, and you have to go to the calls that you need to be. But what about, I know other places across the country have dialed back on maybe that active policing where you're searching for that crime. Have you guys dialed back in any way?
Sure, the question was about active policing. We're trying to limit our contacts. We still are actively doing our job. If you call to report a crime, we will respond appropriately. If we do not have to have a contact, we will avoid that where necessary. But we're still doing the same amount of business other than some small things that might be temporarily inconvenient for the public. We've shut down our public counters, so we have to get services over the phone. Some of the services you can get at our stations, like fingerprinting, have been temporarily seized. Most of our community programs have been ceased. We've temporarily suspended our academy for the time being to stop that close proximity of individuals. So everything that is, I don't use the term non-essential, everything that is mission critical, we're continuing. If it doesn't rise to the level of being absolutely critical to continue, we are ceasing that operation.
Question for Chief Tennessee. A couple weeks ago, you guys had that incident in Irvine where you thought it was a potential coronavirus patient, but turned out not to be. Have you guys had any other encounters like that since?
We have. We're continuing to respond. All firefighters in the county are continuing to respond as we always have. We do have an added measure of personal protective equipment. We're actually doing what's called a 1 in, 3 out, so that if we have a patient that we believe could be infected or showing signs, that one of our firefighter paramedics will go in, make initial contact, and assess. We've had considerable success with our dispatcher. When you call 911, they ask more questions now to determine whether or not this may be a patient that is high risk. Our crews will then make contact appropriately. As of this morning, it was briefed that we had 20 firefighters that had been exposed. Now, when I say exposed, I mean to patients that may have the COVID.
None confirmed?
One was confirmed. One patient was confirmed. I think the frustrating thing for the fire departments, all the fire departments here in the county, is the length of time it's taking for those patients to get results. So if my firefighters make contact with a high-risk patient exhibiting flu systems or symptoms, and there are times when they're showing up for calls that don't appear to be flu symptoms, and maybe 1 or 2 do not have some of the material, they now have been exposed until told otherwise. We're following protocol, but there's 72 to 96 hours sometimes before those patients' tests come in. Lots of anxiety for not just the firefighter, but the family. The protocol is that they go home. Many of them do not want to go home, right? They don't want to potentially bring it to their home. But to date, we've only had one firefighter, Orange County Fire Authority firefighter, that has been exposed to somebody that's been confirmed positive COVID-19.
Are any of those 20 still in quarantine or isolation?
Some are in self-isolation.
You know about how many?
Well, I just got a report on the way in that we actually had 4 firefighters and engine company. The patient's test results have just come in. They were negative, so I believe we're down to 16 or 15, not counting.
So that one firefighter, has he been tested yet, or you're waiting for the results?
Well, the firefighter has not been tested yet. That person is on mandatory quarantine for 14 days. The firefighter that had contact with a positive, at that point they'll take the test. Again, this individual, talk about a tough thing for the family. They are self-isolating in a hotel away from his family. It's a tough thing. So, talking with the healthcare agency, I know that they're working diligently to try to speed up the results of the tests. That will lower the anxiety of the firefighters and their families.
Well, thank you. Thank you all very much for attending today. Appreciate your time.
Thank you.